right, we'll call this meeting to order of the Board of Health. Today's July 12th. We have some members online, but we'll go through and start with roll call. I'm John Strand, your chair, and we'll begin over with you, Valentina. Introduce yourselves and...
Hello, I'm Asiru Valentina, and I'm here today to meet you all. Thank you.
Good morning, Megan Forty.
Andy McLean.
Okay, and who do we have online?
Mayor Dardis, are you there?
Good afternoon, Bernie Dardis, Mayor of West Fargo.
All right, and I'll go through the rest of the list just in case to see if they're online.
Okay.
Jim Capitan. Avish Nagpal. Grant Severson. Jamie Stagg. That completes it.
All right, we do have a quorum, so we will continue. Thanks for everybody for making this work today. Do I have a motion to approve the agenda?
Dardis moves.
Dardis moves. Is there a second?
40 seconds.
Okay, all those in favor say aye.
Aye.
Opposed, nay?
Aye.
Okay. And Bernie, I'm glad you're with us online. Thank you very much for this, Mayor Dardis. All right,
Thank you, Commissioner.
if I could have a motion, please, to approve the minutes from April 4th.
Forty approves.
Dardis moves.
Meg approves, Dardis second. All those in favor say aye.
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 Opposed,
Aye.
nay? Opposed, nay? Okay. Are there any updates from anybody? Jen, would that be you by chance, or? Yes, I'll go to you, Jen Fall, for updates.
Hi, looks like you get me first.
That's good.
As just a reminder, I'm Holly Scott. I'm the Public Information Officer at the Health Department. I just have a short update for you on Credible Mind. So Credible Mind is the online mental health and well-being platform. We launched a regional version of that resource on May 14th. So the partners that are included with that, I'm going to read my list. I want to make sure I don't forget anyone. Cass, Trail, Ransom, Sargent, Richland, and Steele County. So we all came together and decided to do a regional combined platform. So that offers all mental health and well-being resources in those communities, kind of in a one-stop shop. So we were thrilled to be able to announce that the middle of May. We're continuing to promote Credible Mind, mostly with social media content, but also out and about doing community-based presentations. I had a unique opportunity to share Credible Mind at a annual training for North Dakota parole and probation earlier this spring. So that was an audience that we hadn't previously shared the resource with. So something, like I said, we continue to promote it. We have about 958 users accessing the platform right now. So we feel good about that. I'd be happy to entertain any questions, but just wanted to let you know where things are sitting with that.
Thank you, Holly. Does anybody have any questions or feedback for Holly?
No, but I was going to ask about the update, so I appreciate that.
Sure.
Great. Mayor Dardis, anything before we move on?
No, sir.
Okay. Thank you very much. We'll go next to the measles update. Jen, you and Brenton, I believe, if you'd introduce this topic and guide us through it. I see Williams County's in the news again.
Good afternoon. I have Brent Nissemeyer with me. He's the epidemiologist from the state of North Dakota, and he presented with commission as well when we gave a measles update with commission. So Commissioner Strand, you're familiar. I'll let him start, and then I'll go through what we did at Fargo Cass.
Good afternoon, and thank you for having me here today. So North Dakota does have currently this year to date, we've had 35 cases of measles. 17 of those cases were in Williams County, 10 in Grand Forks, 7 in Cass, 1 in Burke. July 4th was the magic 2 incubation period, or the 42 days since Cass County has seen a case. So that would mean that the outbreak or the instance of measles in Cass County is over. We did have a new case, as you alluded to, in Williams County this week. We do think that this case is related to out-of-state travel and not associated with the current, what currently was going on in North Dakota. So that case was an isolated incident, is what we believe from our epidemiological or our investigation standpoint. And that kind of concludes like the epi outbreak.
When it was active in Cass County, Fargo Cass Public Health did host 2 clinics, so people could come in to have their MMRs if they hadn't been vaccinated. During those clinics, we were able to vaccinate 46 people, and then we had continued walk-in appointments to our clinic on site for other immunizations that they were getting throughout the regular weekday schedule when the clinic was open. We also communicated with Essentia, Clay County, Family Health Care, and Sanford in regards to testing for measles, as the public health units were not allowed to do testing for this. And so the communication plan was established with our other healthcare providers as to where they would go to have testing completed, so they wouldn't be going through large lobbies of other healthcare entities. So we communicated a great plan with our partners, and then Dr. Lindemann was instrumental in getting that information out to the independent providers as well. And so a communication plan for our community had been established.
Okay, any questions from any of the board members? No. I'm just curious, how is it across the river? We hear North Dakota. I'm just wondering, how is it looking over on the Minnesota side compared to us?
So we are in communication with our Minnesota counterparts. The last I looked, which was actually yesterday, Minnesota had 5 cases of measles year to date. I believe all of them are outside or nearing that 2 incubation period as well. The cases have all been down in the Twin Cities area. I know that 2 of them for sure were in the same family unit, and one of those was associated with the case that was seen at the Mall of America or Nintendo Universe during a few weeks ago.
Thank you, Brent. And let's hope this is our last need to report measles in the future.
Yes,
But
let's hope that.
Appreciate everybody's attention to this. Anything else, Jen or Brenton, for this topic? Okay, we'll go on to the oral health program. And Jen, would you like to introduce, is it Larry and Jordan who will be doing this? If
I
you
will
could.
let Larry introduce Jordan.
Perfect, thank you.
Thank you.
Good afternoon, Board of Health. My name is Larry Annenson. I'm the Director of Health Protection and Promotion at Fargo Cass Public Health. And one of the 10 essential public health services is to build and support a diverse and skilled public health workforce. With this in mind, it is essential that our agency continues to provide opportunities for students whenever possible. Recently, I was asked to serve as a preceptor for a Master's of Public Health student from North Dakota State University. Last spring, Jacob and I met to discuss potential projects that would make a positive impact not only to Cass County, but possibly throughout the state. We decided to explore the possibility of initiating a fluoride varnish program at Fargo Cass Public Health. Jacob officially started his work June 9th and has done an outstanding job researching the need for a fluoride varnish program. Although there is still much work to be done on this project, Jacob is here today to share his current findings. And with that, I'll let Jacob take it away.
Thank you, Larry.
Thank you, Dr. Annenson. Good afternoon, everyone. Thank you for having me here today. As Dr. Annenson mentioned, I'm Jacob Schroeder. I'm entering my 2nd year into NDSU's MPH program, and part of my summer practicum, I am working with Fargo Cass Public Health to help develop an oral health project that surrounds fluoride varnishes. So we are in the process of developing a fluoride varnish program, procedure, and policy that the LPN and RN nurses at Fargo Cass Public Health would be able to use. Since oral health disproportionately affects our vulnerable and disadvantaged populations, not only would a service like this support community needs, but be cost effective for them at the same time. Inequity surrounding oral health also affects these same populations, since many of them may not visit the dentists regularly. Many of them may use bottled water instead of fluorinated water that they may have access to, and many of them may not get early prevention or know what it looks like to partake in preventative efforts to promote good oral health. So this program at Fargo-Cass Public Health would provide our disadvantaged populations with oral health care that they may not be able to access elsewhere and improve their overall oral health. A few populations that this program would be able to benefit are those disadvantaged populations and those specifically coming to Fargo-Cass Public Health that are looking for services. Those could include WIC families, individuals experiencing homelessness, children receiving immunizations, and even adults as well. Fluoride Varnishes offers a quick, safe, and effective method to improve oral health, which in North Dakota is covered by Medicaid. But for those without Medicaid or without any insurance, we're wishing to impose a sliding fee just to make the service a bit more accessible to them. But in the end, we don't want to turn anybody away. We feel that this service is too important and too beneficial for the community that if they can't afford it or they don't have insurance to cover for it, we would still administer the fluoride to them. We also want to note this is completely voluntary. We don't want to force this upon anybody. When they come in for other services, we'll make mention of what a fluoride varnish is, how it's effective, and how it can help them with their overall oral health. And if they agree to that, we wish to administer that fluoride varnish on that same day at that same appointment that they come in, just because it may be hard for individuals to get to the office in the first place, so we don't want to miss out on those opportunities that they're already there. But if they refuse, that's perfectly fine as well. We're thinking of creating an educational pamphlet that we could send home with them, again, surrounding why it's important for fluoride varnishes to be implemented in oral health. Maybe they can change their mind. And if so, we're thinking that walk-ins would be accepted just because of how important we feel fluoride varnishes are. So why is oral health so important? Well, poor oral health can lead to a variety of health problems that range from hypertension, respiratory issues, cancer, and can even lead to death if left untreated for prolonged periods of time. There are also social issues that come along with poor oral health, such as low self-esteem, reduced quality of life from pain-associated symptoms, and then speaking and smiling are at the forefront of all of our conversations, so people may change how they act around other people if they have poor oral health. In the United States specifically, from 2017 to 2020, around 46% of children aged 2 to 19 years had untreated or treated dental cavities, and around 90% of those 20 years and older have had dental cavities in the past. So this is affecting a wide range of people, not only on a state level or a country level, but it's a worldwide issue. Even the WHO in 2021, they classified untreated dental cavities in permanent teeth as the most common health condition worldwide, in part due to inadequate oral health infrastructure and a failure to get proper education of preventative efforts out there. So all of those problems I was just talking about are a direct result of fluoride usage. Fluoride is a naturally occurring mineral that enters the body with food, water, through the air, and products that contain fluoride, such as toothpaste and mouthwash. Fluoride strengthens the teeth, reduces the risk of dental cavities, and prevents the growth of cavity-causing bacteria. Every day, the enamel, which is the protective outer layer of our teeth, gains and loses minerals through two processes called demineralization and remineralization. Tooth decay occurs when there is too much mineral loss and not enough mineral gain to where those cavity-causing bacteria replicate enough to lead to poor oral health and cavities and tooth decay. There is concern of an overexposure of fluoride in children, and this is a possibility. There are two kind of categories that they classify this into. The first is called dental fluorosis. This is characterized by a discoloration of the teeth, usually caused from an overexposure of fluoride in fluoride-containing products such as toothpaste and mouthwash when children swallow them. It's not known to cause any other symptoms or anything, just a cosmetic issue, and it doesn't degrade the function of the teeth as well. Unlike dental fluorosis, skeletal fluorosis is a bit more severe. It affects more of the bones and joints of aging children. It can lead to stiffness and even deformities as well. This occurs in areas where there are naturally high levels of fluoride in their environment. So in the United States, this is very rare to see. We don't see it very often since fluoride is fairly regulated. So if we have fluorinated water and these fluorinated products, why is there a need for topical fluoride treatment? Well, those products are not enough to protect the teeth. In a perfect world where we didn't have a sugary diet or processed foods or took part in any activities that would hamper our enamel, those would be enough to protect our teeth. The American Dental Association recommends fluoride varnish application for children starting at the age of primary tooth eruption, which is around 6 months old, 2 to 4 times every year. This varies on a case-by-case basis, depending on a bunch of different factors. Some people may need as little as 1 fluoride varnish a year. Some people may need upwards of 6 fluoride varnishes a year. Just depends on numerous factors. Early childhood caries is a chronic disease that affects the teeth of children, which is influenced by biological, behavioral, environmental, diet, and socioeconomic factors that do affect more of our disadvantaged and vulnerable populations. Luckily for us, there have been numerous systematic reviews and meta-analyses that look at the effectiveness and the safety of fluoride varnishes. Overall, systematic reviews show 25 to 45% reduction in dental cavities, 63.6% remineralization in fluoride varnish use compared to no treatment group. Children aged 12 to 24 months who received varnishes had a 31% reduction in dental cavities compared to a non-treatment group. Simultaneous use of fluoride varnish with fluoride toothpaste and mouthwash inhibits dental cavities more than just using fluoride toothpaste and mouthwash alone. And this just kind of goes on and on and on. Many articles show that yes, fluoride varnishes are effective in promoting good oral health and reducing the risk of dental cavities. The National Toxicology Program even evaluated fluoride exposure and its association with neural development and cognition in children. And they did find an association between higher levels of fluoride and lower IQ in children. Their findings was a baseline of 1.5 milligrams per liter of fluoride in their environment. And in the next couple of slides, I'll talk about the recommended level, which is far below that level. But they did not find any association between that 1.5 milligram per liter level or lower and lower IQ in children. This map on the top left here just shows the top 10 states and the bottom 10 states that serve their community by fluorinated water. We can see Minnesota and North Dakota are both in the top 10, which is great. But there are still 74 million Americans who are on public water systems that lack access to fluoridated water. So that is a large chunk of our population that are at risk of poor oral health. And then I kind of wanted to see if there was an association between the top 10 states and bottom 10 states and the rate of cavities in those states as well. So the other map here shows the percentage of third graders with dental cavities by state. And I do think that there is a little bit of an association. If we look at Minnesota, Illinois, Indiana, Georgia, South Carolina, they are on the lower end of percentage of third graders with dental cavities. We can kind of say the same thing about the bottom 10 states, Arizona and Louisiana, Idaho. I think there is some connection between the two. But the one state that I find interesting is North Dakota. We are in the top 10 for serving the community by fluorinated water, yet we still have some of the highest rates of cavities in our third graders. So there still is something missing here. As of 2019, 37 states have fluoride programs in place to supply fluorinated water to the public. The U.S. Department of Health and Human Services recommends 0.7 milligrams per liter of fluoride in drinking water to prevent tooth decay and promote good oral health. So when I was talking about that National Toxicology Program, they use that baseline of 1.5 milligrams per liter and higher as an association with low IQ in children, and this is well below that. And again, North Dakota ranks as actually the number 5 state in the country as serving their population by fluorinated water. Looking at North Dakota specifically, 21 out of our 53 counties have all of their water systems fluorinated, which supply about 96% of the state's population, which are shown in the blue counties there. And that's not to say the orange counties don't have any of their water systems fluorinated, it's just that some of them that serve the public are not. There was an average level of 0.28 milligrams per liter in non-fluorinated drinking water compared to 0.82 milligrams per liter in fluorinated drinking water.
Jacob, just one while you're there, and bear with me. If you have questions, shoot them at them. But Grand Forks and Minot don't have fluorinated water?
They do. It's just the counties, like in general, not all of their water systems are fluorinated. So I believe most of the major cities in North Dakota do supply, Fargo, we have fluorinated water here. But just to show, there are like more rural areas that supply non-fluorinated water to the public.
Thank you.
Just kind of wanted to show that there's still a lack of fluorinated water, and which could lead to poor oral health overall. Diving a little bit more into the statistics here, during the past year, more than 1 in 4 children went with no preventative dental care visit. 1 of every 2 kindergartners have experienced tooth decay. Children living in rural areas experience higher rates of decay. More than half of adults who are indigenous reported no dental visit in the past 5 or more years, compared to 31% of non-indigenous. So again, this is affecting all age groups, and even those that may have Medicaid beneficiaries. As we can see, many of them did not have any preventative or treatment-based dental care in 2021. So although they may have the means to afford them through insurance and stuff, they're just not receiving the care that they more than likely need. And then I kind of wanted to look at the dental workforce in the state as well. Based on the state population, only 44% of the need for dental providers is being met, which also contributes to a rise in the high rate of dental cavities as we've seen before. Figure on the left shows the percentage of kindergartners in North Dakota with oral health concerns and dental visit need by geography. So rural, semi-rural, and then urban. As we can see, the rural areas are affected way more significantly than their urban counterparts when it comes to poor oral health. 80.6% of rural kindergartners in North Dakota experience some sort of decay. 56.7% untreated decay. Among all those categories, the rural populations are hit hardest. The other figure here shows the percentage of children and adolescents with a preventive dental visit in the past 12 months. We can see in the mid-70s, we think that's great. All these children, they're going in, they're getting the care that they need to promote good oral health and reduce the risk of cavities. Here, we're looking at the percentage of kindergartners in North Dakota by oral health indicator and race. So they own their own toothbrush. Have they brushed their teeth today? Have they ever been to the dentist? What I wanted to focus more on specifically was have they ever been to the dentist? Among all races in kindergartners in North Dakota, you can see 80% of them have been to the dentist, which again, we think is great. They're getting to dentists to get the care that they need. But then we look at more statistics like this, the percentage of kindergartners in North Dakota with oral health concerns and dental visit needs again. Almost 70% of all kindergartners among all races having some sort of DK experience, upwards of 50% need for early or urgent dental care. So even though they're getting to the dentist, they're not getting the actual services that they need. And I found interesting was that the American Indian Alaska Native population is hit hardest in all of these categories as well. As you can see, upwards of 93% of American Indian Alaska Native kindergartners in North Dakota had some sort of DK experience. Almost 62% need for early or urgent dental care. This population is being affected a lot more significantly than any other one. Just wanted to show it again with this other figure that throughout the years, it's kind of just gotten progressively worse and that they're still leading the category in poor oral health among all of those years. So looking at Cass County specifically now, we have 31 water systems in the county that supply water to the public, 26 of which are fluorinated, which do serve 99% of the county's population. And there's an average fluoride level of 0.65 milligrams per liter among all the water systems, so that's right in par with what the U.S. Department of Health and Human Services recommends. Looking at some more statistics on Cass County versus the state overall, respondents who reported they have not had a dental visit in the past year, 27% compared to 34%. Respondents who reported they ever had a permanent tooth extracted, 9% compared to around 13.5%. This was the most up-to-date data that I could find when it came to oral health on a county level, and I wish I was able to find more to show you guys, but we're going to keep our eyes open, and if new data comes out, we'll take that into consideration. So here in Fargo, everything is already really in place. We're a unique area that has the foundational resources to support oral health for the county's population. Since our water is fluorinated, North Dakota Medicaid covers varnishes, and we have many dentists in the area to serve public needs. What we're lacking, though, is a more accessible program to serve more of our disadvantaged populations, though, and that is something we think that Fargo Cass Public Health could help with. I learned something recently that Fargo Cass Public Health is doing. They're creating a Wellness on Wheels van. They're putting together a bunch of healthcare related services in this van, and they're traveling around the county to these rural populations, these rural areas, to serve those communities that may not get the proper access that they need to healthcare. And we thought that adding fluoride varnishes onto this van to get to those rural populations would be great in lowering those rates of cavities and such, since they are hit hardest. And then we can also lead to established practices elsewhere. Fargo Cass Public Health can become a leader. Other public health agencies can look at us and see what we're doing and practicing for our disadvantaged populations that need the care the most. So they can look at us, take what they need, and maybe even establish it in their places of practice as well. Again, fluoride varnishes, they're safe, they're quick to administer, and they're cost effective for our most vulnerable populations, which will not only improve community health, but of community health across all of North Dakota. Thank you again. If you have any questions, comments, or suggestions moving forward, I'm eager to hear.
Dr. McLean?
Yeah, great project. Jacob, thanks. I'm glad you pointed out that discrepancy with North Dakota. That's almost worth a study of why we're so high, one of the top 10 states in fluoridation, and yet 2/3 to 3/4 of our third graders actually have dental caries. I mean, that's, I think it'd be really important to look at that. And then, one of the questions would be, is it because of our behavior? Is it something different? You noted that American Indian, Alaska Natives, 89% of kindergartners drinking pop. Are there certain behaviors that can be intervened on?
Meg?
Jacob, I want to thank you for your thorough and really technical presentation. My question for you is, if I was a very nervous 6-year-old, what would you tell me that a fluoride varnish is and how you're going to apply it?
That's a great question. Not something that I have thought of yet. I'm sure we would try to just make it as kid friendly as possible. Maybe put up like a little poster or something that just maybe is more inviting to them to come in, makes them feel more safe. Obviously, describe to the parents what it is as well. Maybe they can comfort their children, but that's definitely something that we'll look into.
Yeah, and I guess I just asked this, Jacob, because looking at the primary population being children that this program is going to be serving, just to make sure that they're not objecting to any additional burden that they might think that it might be like. So thank you.
Valentina, anything?
Awesome project, Jacob. So one comment I had was, in regards to the homeless population, we do recognize that this population presents to various places in the community. And so in view of kind of expanding access for the homeless population, have we thought about an opportunity to partner with community agencies like the shelters, the human service centers, just to expand access for the homeless population? Is that something we can do?
I believe that is something that we could look into moving forward. This is just kind of like a baseline, setting the foundation, and now we're gonna, outreach a little bit more, create policy first, and move forward from there. So I think that is definitely a possibility.
Okay. Great job.
Thank you.
Mayor Dardis, any questions or feedback?
No, sir.
Okay, Jacob, I'm just curious about a couple thoughts. How much of this is diet related? We're talking about the results you see, but then we might be dealing with populations that go home with pockets full of candy bars and sugar. I'm just wondering.
Yeah, sugar is one of the greatest contributing factors to poor oral health. It just promotes the growth of that bad bacteria, and it just eats away at the teeth. And just shows that I think even fluorinated water itself is not enough to protect the teeth, and why we see rates so high, which is why we do need fluoride varnishes. So diet, I do believe, plays a big factor.
And Jen, if you could maybe remind us, you advocated and this board took a position and the legislature addressed it. Could you just summarize that whole topic of the state legislative approach to fluoride this last session?
There was a proposed bill that we not have fluorinated water and that it would be illegal to add fluoride to water in the state of North Dakota. That bill was defeated overall through the state. There are independent counties that still opt out of that. So right now in Cass and throughout most of the state, as Jordan referred to does have fluorinated water.
And help me understand the relationship nationally. Isn't there a push from the Department of Health to maybe eliminate fluoride nationally with Robert Kennedy?
Still in conversation. I know nationally they have reduced the oral health care overall. The CDC's program for oral health has been decreased or is proposed, or actually it passed, so the bill did pass. The CDC's oral health program and the Health and Human Health Resources and Services of America program are losing their oral health components, and the Ryan White program is losing their oral health component as well. So this would be a gap filler for some of those populations also.
And Jacob, I'm curious about rural access. You know, I work closely with aspects of people of the Native community, and some parts of the state, they just have no access to dentists hardly. Is that mobile unit going to address some of that, or how do we address that need going forward? And I know we're in Fargo, but
Yeah, so what Fargo County Public Health is doing, it's just a county level thing, so they're only going to the rural places in Cass County specifically. Again, just funding issues and such. But I mean, I wish we could get to more of these rural populations. I just don't know if that is possible at this current time, considering the constraints that we're dealing with currently. But I wish that we could reach more of even more rural populations. I think people are lucky that they are kind of by Fargo, even like on the outskirts of the county, to where we could get to them now and serve them. But moving forward, I sure hope we can get access to more rural counties.
And Jen, do you have something you're going to chime in? No?
We'll
Larry?
just add to that, one of our goals of this project is to be a leader and show what we could do and just some suggestions. So we're hoping that other local public health units in other areas across the state can take what we've learned, lessons learned in some of our programs, and utilize that as well. So we're more than happy to share the information so it can expand throughout the state and beyond. So that's why we're really excited about this, and we just really want to be a leader in this area because we think there is an opportunity to really impact the community health throughout the state.
Anybody else? The Native issues concern me because everywhere we look, we see a lower success rate in the Native populations on many health-related topics. You know, and they all add up, and they snowball. You know, so I just always remind us, you know, that that's a really high priority across our state. A Native American person in North Dakota lives 20 years less than me by average. And all these components are part of that bigger picture, but this is really valuable information. Thank you very much for sharing it. Dr. McLean?
Yeah, and I just wanted to add, that's why the partnerships are obviously so important. And, sovereign nations, they have access to certain resources, but they would be making the decisions about how to use those. And I think just sharing the information in a collaborative way is really useful, as opposed to telling them, this is your problem, this is what you need to do.
Okay. Anybody else on this topic? Thank you both very sincerely.
Thank you again.
Okay, our next item on the agenda is community health assessment. I'll start with Jen, and you can assign out to who will be discussing it, please.
In addition to Larry, we were equally as excited to have Maggie Riddle join us as an MPH intern who took on a rather ambitious project for Fargo Cass Public Health with the community health assessment, bringing us current and having met with community stakeholders, some of the board members also being able to partake in the process. Maggie comes to us and has been there since May, I believe, and really dove into the deep end to bring us up to speed with the community health assessment. We're eager to have her research and statistics drive and her epidemiology background in wanting to get into this, and worked really well with our community providers to bring the data forward for what we can be moving forward with at Fargo Cass Public Health. I'm going to let Maggie go ahead and review the project that she put together, and we'll be available for questions.
Okay, thank you, Jen. Maggie, the floor is yours.
Thank you so much. All right, I wanted to start out just by talking a little bit about a community health needs assessment and a community improvement plan and the benefits that we can realize from these projects. So these reports really do identify health priorities by using a data-driven approach, and that will help uncover unmet needs and health disparities. And that will then lead to more guided strategic planning and resource allocation, which allows for more targeted interventions that address root causes of poor health outcomes. From there, we can expect that to foster greater community collaboration because it engages more stakeholders and community members to become involved, which will therefore develop community-informed health solutions. And really the backbone of a CHNA and CHIP report is utilizing the MAP 2.0, which is the mobilization for action through planning and partnerships. It is a very strategic framework. We will be more formally immersed in the MAP process in future CHNA and CHIP cycles. We were sort of in a recovery period post-pandemic for these reports, and so the formal use of these was more loosely associated. However, we did emphasize shared vision, long-term partnerships, and community-led planning through these assessments, which will allow us for a more a greater commitment to equity-driven and sustainable improvements in community health. I really want to point out the image on the lower left-hand corner, and that really just shows all of the partners that come into play when it comes to coming up with public health strategies to develop more positive health outcomes for all in our community. So our current CHNA process, this is a visual to demonstrate what work has been done and what is yet to be done in this process. So the first box there, the blue box in the upper left-hand corner, measuring the public health of Cass County. This phase included extensive consultation with local public health professionals, community leaders, and other health systems to assess the current health conditions and system capabilities. And that has taken place since the last cycle, which then led us to the data analysis phase, which was conducted in April. And that data analysis was community and stakeholder survey responses, or our primary data, which was measured against secondary sources as well. And those were analyzed to identify health trends, disparities, and community priorities. And then on the upper right-hand corner, the yellow box, is internal and external stakeholder meetings which took place. And this is where stakeholders participated in asset mapping exercises which helped identify the most pressing community health issues and needs, which led to very vital and helpful, thorough collaborative dialogue. And then yet to do, you see the bottom green box there. So the Cass Clay Working Group meetings will be taking place again still this month and then next month as well, so in July and August. And these multidisciplinary groups will be tasked with developing the CHIP plan further, such as setting strategic goals and really assigning roles, and creating implementation plans for future programs and services. Also to note, in the past, our CHNA and CHIP reports were typically two separate reports. We will now be combining those into one report. If you're familiar at all with the Sanford and Essentia community health needs assessments, they do the same process where they do combine them into one report, and I feel like that will be a much more fluid process going forward. And so part of that then is, once the Cass Clay Working Group really helps define our strategies for a CHIP plan, then we will need to develop evaluation strategies for those public health initiatives. And that process is going to include planning how we are going to evaluate those health outcomes, particularly focusing on the social determinants of health and how they could be positively or negatively impacted by those strategies that are moved forward. And then finally, we do need to improve the primary data collection, and I'll get into that a little bit further when I talk about the limitations. And this is recognizing the need for more inclusive data, and future efforts will focus on developing a more culturally competent data analysis plan to represent more underserved populations. So taking a look at our primary data collection and the community survey methodology. So to inform our 2025 Community Health Needs Assessment, a survey was conducted in partnership with Sanford Health, who provided our cross-tabulated data specific to Cass and Clay County. For the purpose of the 2025 CHNA and CHIP reports, the analysis focuses solely on Cass County survey results. And this is key because the Sanford and the Essentia reports, very valuable, but they focus on their hospital's footprint, where our report is solely focused on the residents of Cass County. Each survey question was measured, as I mentioned, they were in crosstabs, so each survey question was measured against demographic variables such as age, sex, sexual orientation, and race, which allows a deeper look into disparities that do exist among vulnerable and underserved populations in our county. So on the slide there, this just gives you a little more information about that survey. It was developed in partnership with the University of Wisconsin's population health model, and that's the image that you see on the left. This drove the type of questions that were included in the survey. It was a Likert scale, and it provided both quantitative and qualitative data, so it was a very good mixed method survey. The Likert scale asked respondents to rank each question from 1 through 5, 5 being excellent. Anything less than a 5, they were allowed to write in more detailed qualitative information. The survey data is directional and will always be presented with secondary sources for additional context. So for Cass County, our sample size was 1,199 responses. Those represented 67% stakeholders and 33% paid panel. Stakeholders are a combination of health and public health professionals, and paid panel was residents from Cass County who took part in the survey. Some of the limitations that are important to highlight here. Sanford published this in their Community Health Needs Assessment, and Fargo-Cass Public Health also recognizes that survey collection and demographic reach are key areas for improvement in future CHNA cycles. And some of the things we can do to address these limitations, again, developing that culturally competent data collection and analysis plan, more engagement with community leaders who offer specialized knowledge about vulnerable and underserved populations to increase that reach. And then also, again, really looking at the secondary data sources such as the US Census Bureau and county health rankings. I do want to note for the room, and I'm sure some of you are aware, county health rankings could be going away as of 2026 due to lack of funding, which I think argues for more robust data collection within our own county to make sure that we do keep a good grasp on that. And then one other thing in the limitations I want to point out too, with our limited collection, when we looked at the results for Cass County, the respondents made up of 91% Caucasian or white, 65% of them were homeowners, 59% earned $75,000 or more a year, 40% were well educated with a bachelor's degree or more, and 57% were married. So again, we're just looking to get more of an underserved minority population involved in that survey response.
Bear with me one second. Is that a county data point you just shared with us?
Cass County, correct?
So
Yeah.
and what was the percentage of homeowners?
Homeowners, 65% owned a home that responded.
So that's county, and then you get to Fargo, it's flip-flopped. We have about 60% of our people in apartments. Just to kind of consider that demographic, and
Yep.
you know, it used to be 60-some% owned homes, but so that's a different group to get into, I'm sure.
Yep,
The apartment owner, or apartment renters.
correct.
I'll let you continue. Thank you.
Yep. And I brought those up because as we look at our summary here, this is the quantitative data. This is a summary of the different headings for each of the questions, the different topic areas. And you notice affordable housing there was the worst ranked. That was at a 2.2 out of 5. Now, considering the respondents to this survey were well educated, made $75,000 a year and so on, they still ranked housing as a 2.2. Some of the qualitative data that we got from this, where they voiced the concerns, were consistent between stakeholders and paid panel. And those concerns were cost of housing, access to housing, and their wages not keeping up with the cost of housing. So just something to keep in mind there. But you can see childcare and access to transportation as well, kind of bubbling towards the bottom.
So this is ranking how they see these services or these entities available. It's not their rank of importance.
Correct. This is how they responded to the questions asked in regards to each of these topic areas. Yep. I also want to point out the areas of focus from our very valued partners, Sanford and Essentia Health. These were their focuses for their community health needs assessment. I think it's important that we bear these in mind as we move forward with ours as well. So Sanford Health really does support those survey respondents, that qualitative information. One of the questions that they were asked, in addition to the summary you just saw, what are some of the services you would like offered or improved in the community? And those responses included behavioral health, addiction treatment, walk-in, urgent care, family medicine, and primary care. So when you look at Sanford's goals, mental health and behavioral health and substance abuse really hones in on that, as well as access to health care and providers and quality care. And then Essentia kind of hit on some of the lower ranked areas as well, social drivers of health, which is an all-encompassing goal, nutrition, physical activity, and housing.
Maggie, would we anticipate that this information would be mirrored in the Veterans Administration population of that they serve?
So that's a good question. I don't know if veteran status was asked of the survey respondents, but that would be a very interesting survey to do, specific to a veteran community, to determine what the needs are there. But to my knowledge, veterans, that was not a demographic question addressed. So I'm not sure how that would stand out on its own.
I would be just curious how they see things and how it fits for them versus the rest of the delivery system. And we have a pretty robust, as I see it, naively, I'm on the outside, pretty robust Veterans Administration here, especially compared to years ago.
Yes.
When we had like 5 hospitals in town. But
Yeah, I think we have a very good VA. Yes.
I'd be curious how they fit into all this and where they are relative. And maybe those patients are already serviced, are they, by Sanford and Essentia too, or not always?
I think veterans have a choice with some services who they seek care from. But again, I think that would be a very interesting survey to dig into deeper. Part of that, reach to more underserved populations. I would put veterans in that category for sure. Yep. Okay. So at the conclusion of our stakeholder meeting, our external stakeholder meeting that took place on May 16th, we had a lot of very valuable community leaders in the room, and their time was very appreciated. And what we did was we had different tables spread out throughout the room so that they could have collaborative conversations. Fargo-Cass Public Health had directors sit at each of those tables to help facilitate those conversations and really steer that, and also to offer, any information in regards to the services that Fargo-Cass Public Health offers, as well as we strategize and look at the questions. The first polling question that was asked was to select 3 priority areas where they felt Fargo-Cass Public Health could have the most impact. And the ones that bubbled up to the top were childcare, access to healthy foods, and health and wellness. And then the next polling question was 3 priority areas that should advance to our community health improvement plan, and they were the same. The weight was a little different, but the same 3 categories bubbled to the top: access to healthy foods, health and wellness, and childcare. So these will be our initiatives in our CHIP plan going forward. Again, I mentioned that qualitative piece of the survey. So when we looked at the written in responses to those, some of the focus areas for each of these. So under access to healthy foods, the concerns, again, that were consistent between stakeholders and paid panel included cost of food, access to food, transportation to get to food. So some of that gave us a great lead on areas that we could focus on to move that forward in the CHIP. The next one, health and wellness. The voice concerns there were cost, chronic conditions, mental health, exercise, and healthy foods. So again, that helps steer that CHIP initiative. And then finally, childcare, the concerns voiced there were access, cost, and quality. And again, these were consistent between paid panel and stakeholder respondents. And then we also asked the group to identify a priority area where we could work towards a community goal together. So we're all working towards moving that forward. And what was voted on there was health and wellness as the shared goal. So that has been identified as that priority. So work groups are going to use, again, primary and secondary data to identify disparities and evaluate the effectiveness of strategies put forward for health and wellness. And this will take place during that 2025 to 2028 cycle for the CHNA and CHIP.
Maggie, would you just simply, for me, define health and wellness?
I think health and wellness is all encompassing, which is why I was very happy this bubbled to the top, because even like Jacob's presentation on oral health can fall very nicely under health and wellness. And so some of these initiatives are probably already in place. It's just we need to formally document them and track them going forward, make sure we have robust evaluation to measure and have that data-driven information ready to prove that we should continue with these initiatives going forward.
I could just add more onto that one too. Some of the other ones that we've looked at that we already participate in would be our cancer screenings. It would be our tobacco work, and heart disease is another one that we would be looking at screening, and obesity and exercise were other metrics that fit into the health and wellness categories.
Okay.
Yep.
Any board members have any feedback or questions at all? Meg?
Thank you. You presented such a great approach to the design of this survey itself, but I really encourage you to keep in mind how the outcomes are reported and being sourced on the graphs to enhance the validity of the data that you're collecting. So is there, this may be a very technical question, but to really enhance this robust data that you're collecting, is there a statistical analysis plan for the data management that you're collecting? Have final metrics been established for these formulas and algorithms that you're using? Is someone doing this statistical analysis to determine these numbers?
So when I did the data analysis on the cross tabulations that were again provided by Sanford Health, I do have a data book available that can be provided as part of the report. I also plan in the appendix of the community health needs assessment to offer the survey questions that were addressed as well. As far as more of a statistical analysis, that's going to be work ongoing as we go through this cycle.
So if someone chose to skip a question or if a question it was undetermined how they responded, do you know how that response may enter into the data? I guess I'm just concerned that if it would shift any of the responses in any certain way, if that makes sense.
I can reach back out to Sanford. We got very limited information, unfortunately. The cross tabulations that were provided were already aggregated for us. So to dig deeper, that is possible. That data is out there. We just don't have it at our disposal at this time.
Okay, thank
Yep.
you.
You're very welcome. Great question.
Thank you, Meg. Anybody else?
John, it's Bernie.
Mayor Dardis?
Yeah, my question follows the lady's question. So at the end of, I think she said 2028, this program is. So how are you going to measure that again? You're going to survey the same people to see whether or not the rankings have changed? How are you going to measure the metrics of success?
So with each initiative we put forward in our CHIP plan, that's where that work group will come in. We will have to develop strategies around evaluation for each program that is put forward. So whatever solutions are put forward for, let's say, childcare or health and wellness or access to healthy foods, we'll have to develop those evaluations as we put the strategies forward so that we can have data-driven information if it is successful. That is not developed at this time, so that is going to be something that we will, that's why it was on the to-do, if you will, on the CHNA process that we're currently working through.
My follow-up question is, is along the lines of Commissioner Strands when he asked about what is health and wellness, because there's a great deal of the public and trained professionals that mental health would be one of the things that would jump forward onto them, and if that's not delineated in the questions as to whether it's their physical health versus their mental health, how does one disseminate that information?
So I think it would be disseminated based on the strategy that's put forward. So the strategies will be very specific towards a certain initiative, and that will either be physical or mental health. And so then we can go forward with how we're going to evaluate that, if that answers you.
Thank you.
As Mayor Dardis is asking questions, whenever I hear him, I'm also reminded of some of his priorities that he espouses, that he leads with. One of them is suicide prevention.
Yes.
And then another one for many of us is substance abuse disorder. How does that all fit into this category of health and wellness?
Well, that is one area we could certainly look at as a strategy, because suicide rates, especially among the Native American population, I don't have the numbers, but it's a tragedy. And I know that North Dakota has a higher suicide rate as well for young adults. And so that could be an area that we look at as we look to really pool resources and look to see what's going and coming as far as funding. That is a great area of focus, just so that we don't lose any of those things in place, such as crisis lines and things of that nature. That will be something that we'll have to definitely be paying attention to.
Because for a lot of folks, that's where the rubber hits the road. Is things that are real in their lives, in their purview, their families, and their circles of people, and if they're battling substance abuse or somebody's self-esteem is such that they're self-destructing, and going down those paths, that's what they see. Thank goodness we have public health to address and help.
Yep. I think it all comes down to everything comes into play. If a person doesn't have stable housing, if a person doesn't have someone who can talk to them about their mental health, if a person isn't doing their health screenings and they get diagnosed with cancer, that can all be detrimental to one's mental health and lead to suicidal ideology. And so I think it all comes into play. And that's, again, why I think it's important health and wellness bubble to the top, because it gives us the latitude to explore as many strategies as we can.
Dr. McLean?
And most all of the healthcare organizations now are doing screening when they do see individuals on, suicidality, depression, anxiety, et cetera.
Yep.
What a broad topic.
I know.
We could spend days talking about the elements of this and drilling deeper and deeper. And, my mind also goes down the paths of our youth who struggle. And there's just, where do they fit in? And who's there to help them? And who's there to help a kid that's maybe wrestling with trans ideation or whatever, issues of their own sexuality, identity? I mean, that is just, it's beyond my comprehension where we begin and where we all can go. Anybody else? Thank you very much. Are you done?
These were just some of the comments polled to the group when asked, how their organization or group could help with, the community goal. I'll just give Allie Fast from Essentia a shout out. She had one of the best responses, in regards to health and wellness. She mentioned that, nutrition as one of Essentia Health's goals in their CHNA plan. She'd be happy to partner with us to look at that, as she is also on the board for the Cass Clay Hunger Coalition. So this is just an example of, pooling those resources as much as possible.
Anything else for this topic? Otherwise, Maggie, thank you very sincerely.
Thank you guys very much.
We'll have to keep on this discussion.
Absolutely.
Okay. Going on to our next budget item, I'll call Jen and Melissa to address us.
This
You
is
can
going to
stay
be
sitting there probably even, that's
Yep.
fine.
It'll be very brief. I just wanted to go back to the community health assessment that Maggie had begun here, and we wanted to give you the report of that outcome in the meetings that we've had with the stakeholders. The community health improvement plan, which you guys have already started etching out some ideas and asking the questions of, will be reported back to you in our next meeting in October. And some of you, again, will be invited to participate in the conversations as to what of those priorities that we will take from that health and wellness category and focus on within that community health improvement plan. So I look forward to your participation in the next step as well. As far as our budget, we proposed our budget to the board in our April meeting, and in this meeting, I just wanted to highlight some things that we've learned in the last several months. We had some budget holds from the state as the federal government hadn't released money previously to the state. We were happy to report that that funding is coming back into public health. Our Women's Way program, we were given notice this week that our Women's Way program will be able to resume. It had been on a pause, and the Women's Way program does breast and cervical cancer screen and enrollment. So that is an excitement for us. And our Ryan White program is also going to be funded going into 2026 at a level funding fee minus a Part F, which again is the oral health program and some other categories within the Part F of Ryan White's program. And our immunization grant dollars came into public health as well. So we're happy to receive those. So again, public health funding from the grant perspective is coming back in to support our programs. We are continuing on with the budget and conversations with the city. And we'll continue with a meeting happening on Monday to go through the overall public health department's budget with city commission and the administrators. So right now we haven't made any other additional changes from our budget since we've last met.
Okay, any questions or feedback for Jen? Mayor Dardis, if you have something, join in.
My question to Jen was, would it be an effective visual if some of the Board of Health members were at that commission meeting on Monday night?
It won't be in commission, Mayor Dardis. It will be held in the Red River Room. It is an open meeting that has been noticed already. You are free to join if you wish. And health is presenting at 10:30. 10:50? 10:50. 10:15.
Thank you, Jen.
And that's in the River Room, I believe, upstairs in City Hall.
Yes.
All right. Anything else on that topic? Jen, are you wrapped up with that one? Okay. We'll continue on to the next item, which is bylaw amendment.
As we're going through the budget and looking at all the different ways in which we could save funding that wouldn't implicate any service delivery, this is one of the things that is minute in my perspective of things, but it all adds up, right? In the bylaws for the Board of Health, there is an indication as to how we provide public notice. In the bylaws, it is very specifically written that public notice will be given in advance of the meeting in the Fargo Forum. And you have this in your packet. And I am making a suggested motion that we could change the bylaws to say that public notice will be given via notification to the city's media contact list, as well as posting to the city's website, Facebook page, and social media accounts. It still provides public notice to all other ways without having to spend $200 to the Fargo Forum.
We have our legal counsel in the room. I'm just curious if there's a legal requirement that we give notices in legal official newspapers, which that might be the nature of this official notice. Nancy, are you back there still?
I am here, and I did briefly review this bylaw suggested change. And although we can identify the specifics by the media contacts and so forth, I would also add that it would be in accordance with open meeting requirement, notice requirements of the law, 4404.
Because that's really what we're following is state statute.
That's correct.
So Nancy, bear with me. Does this suggested wording include that adequately?
No, I would include the additional language that notice be given in compliance with all open meeting requirements in accordance with North Dakota Century Code 4404.
Is everybody following that? Jen, any feedback or thoughts on that?
I'm fine with that.
It's just simply what the law calls for.
Absolutely.
So Nancy, would you give us, please, the suggested motion as you'd see it? And then our recorder can or what the recommendation would be to this revision, suggested revision.
I don't have the language right in front of me that was presented to you, so I would include that language and then also indicate that in accordance with North Dakota Century Code, Chapter 4404-04, I mean.
Okay. Public notice will be given via notification to the city's media contact list as well as postings in the city's website, FargoCast Public Health Facebook and X social media accounts, and also in accordance with state statute
Correct.
in other required notices or something. Is that adequate, or did you mention the statute as well?
North Dakota Century Code 4404. We can capture it from the recording.
Perfect. Do I have any questions before we ask for a motion? Is there a suggested motion from the board to incorporate this or consider it?
Dardis moves.
Dardis moves. Is there a second?
40 seconds.
Seconded by Meg. Any further discussion or clarification from the board? Just we're all making sense. Basically, we're just clarifying that public notice will be given and it will be in accordance with state statute as required by state law, which includes legal newspapers and things like that, which could change through time. Okay, any other comments or feedback? All right, I'll call for a motion. All those in favor of the motion as presented, say aye.
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 Any opposed? We have somebody else on a phone there. Could you, is that Dr. Severson?
It's Dr. Severson. Yeah, I was late. I apologize.
Well, no, good. I'm glad. I heard your voice. I want to make sure the minutes reflect you were attending and that you voted. Okay, that motion passes. Did I call for any any opposed votes? That motion passes. All right. The bylaw amendment is done. At this point, we'll call for public comment. There's new requirements from the state regarding public comment from public entities, and we'll be doing that going forward, so we'll just make it a routine item. Is there anybody online or anybody in the audience for public comment today? Okay, nobody's here and nobody's online waiting to speak to us. Any other topics for the good of the order? Dr. McLean.
You're provided with a Fargo water quality report. Was that going to be discussed, or that was not on the agenda?
Correct. I'm sorry. It was going to be in the updates. So the Fargo water quality report is in your packet. That is just given to me to provide back to public health. And that's one of the distribution methods that they use. So it went out publicly and now to our Board of Health as well.
Okay. I had just one comment on reading through, if I could. I was just curious. I'm no expert, but the pH level that they mentioned is actually quite high. It's quite alkaline. And I was just curious as to whether or not that's standard. Most of what I've read, it's a bit lower for tap water, but.
I can report that back. Thank you.
That's an interesting observation. All right.
That's why they pay me the big bucks.
All right. Any other comments for the good of the order? One note just from the chair, we were discussing open meetings and public comments and so on. And just a reminder, we have a couple new members here, but when we communicate, don't communicate with the whole group. Just communicate with who you're communicating with. So Valentina, if you send somebody an email, don't send it to everybody. Or if you get an email, Meg, from the public health, don't reply all, because then that becomes a public meeting where we're not noticing others in the community that the meeting's happening. So just pay attention to, and always remind yourselves that your communications and your actions relative to public health are technically public documents. So be careful using your own cell phones, be careful using your own laptops, Be careful in your interactions with how you do things, and be careful that you all of a sudden aren't inadvertently creating quorums out of public view, things like that. But just pay attention. If you ever have questions, don't hesitate reaching out before you hit send on your emails and things like that. Jen?
I would just like to give a thank you to Jacob and Maggie for an extraordinary presentation and the passion that they have in their public health fields.
I'd like to thank you all for the work you do. The other day I was out in a department store downtown, and this person approached me, and she says, "I know you get bombarded all the time," but she said she's with public health, and she indicated how important it is to see our leadership supporting public health in their activities, especially when times get tough. You know, and we don't say it enough, how much people are appreciated and how much they need to be thanked and how valuable their services are to everybody. You know, it just is sometimes taken for granted what people do, but gosh, I can't imagine if we didn't have this robust public health department and service in our community, where we'd be. And yet you're all challenged. So thank each other, acknowledge each other, pay attention to people's needs, make sure people are happy and well and love their jobs, fight for better wages and compensation, all that. Anyway, anything else for the good of the order? No. If not, we'll stand adjourned and we'll reconvene on October 3rd at noon. Thank you, everybody.